Today we'll be going over one of the most common complaints in pediatrics, which is constipation. Constipation actually makes up about 5% of all primary care physician complaints, especially in the pediatric world. And today we'll be going over kind of how we define constipation, what we can do to treat constipation, as well as build a differential diagnosis of common causes of organic constipation. So first we'll start out with some definitions of constipation, and typically these are measured with frequency of bowel movements, as well as the characteristic or caliber of the stool itself. So kids, we like to follow the rule of threes essentially. So between 3 times a day up to 3 times a week is considered within the normal range of having X number of bowel movements essentially. And then as far as caliber goes, we like to use something called the Bristol stool scale to kind of determine based on whether or not the bowel movement is hard, is soft, is mushy, and it's a scale that we like to rate on 1 to 7 to give kids an idea of how hard or how soft their stool is. As you can see pictured here, this is the exact chart we give kids or allow kids to look at in the clinic. Type 1 and type 2 are more on the constipation side of things. Type 3 and 4 are considered to be within the normal range of what a normal bowel movement looks like. 5 is sort of lack of fiber in diet. And then finally, 6 and 7 is more on the diarrhea side of things. So that's how we kind of categorize bowel movements with this Bristol stool scale. Some other symptoms we like to ask about as far as constipation goes is abdominal pain, which is typically kind of categorized as a bilateral lower quadrant pain that has intermittent sharpness throughout the day. This is sort of the common presentation of what constipation abdominal pain really looks and sounds like. We can also get straining on the toilet. We can get blood in the bowel movement or around the bowel movement. This can be indicative of there being constipation essentially. Kids can also get fullness early on in their meals, and this can be a sign of, hey, there's backup of stool within their bowels, so that kids get actually full pretty quickly when they're not eating. So that's more sort of how we define constipation, but there are 2 main categories we like to group constipation into, and that is organic constipation and functional constipation. And this is a good pimp question. I would say what percent of constipation is functional constipation? And that would be about 95%. So grand majority of constipation we'll see is in kids who are otherwise healthy and have functional constipation. Organic constipation is from some other underlying medical cause. So there is other workup that needs to be done to identify organic or rule out organic causes of constipation before we jump to, say, a functional cause of constipation. Some other organic causes of constipation that need to be ruled out include Hirschsprung disease. This is a ganglionic segment of the colon in which there is distal constriction and proximal dilation that's seen on barium enema. Typically, we do a rectal suction biopsy to see that there is no nerves within the affected bowel segment. Cystic fibrosis is also another common cause of organic constipation, and typically with these we see delayed passage of meconium in newborns, typically greater than 48 hours if they haven't passed stool. Then these are 2 things that we want to keep on our differential to rule out as a cause of organic constipation. Other conditions like tethered cord, spinal cord abnormalities. So we want to take a good look at the child's spinal cord, spinal canal, back to see that there is no abnormalities there. In addition, even celiac disease, an autoimmune disease to a protein of gluten, can be a common cause of constipation, especially more in our sort of adolescent teenage years. One other final organic cause of constipation that can be easily detected on lab work is electrolyte abnormalities. So things like hypocalcemia, hyperkalemia, even I think hypomagnesemia can be causes of electrolytes causing constipation, and these can be easily corrected with supplementation. And now moving on to functional abdominal pain. So when we rule out other underlying medical causes of constipation, we like to turn to and kind of label kids with functional constipation, especially if there's no other medical condition that they're suffering from. Typically, the underlying cause of functional constipation has to deal with painful poops or painful defecation. This kind of creates a vicious cycle in a way. So if there's painful defecation, then we can have withholding behavior. Withholding behavior is something we very commonly see because there is pain associated with defecation. So after we have withholding, we can get temporary relief of our urge to defecate. This pushes stool back up into the rectum. It actually can lead to rectal and colonic dilation, especially if it's been going on for a long time. And this, again, leads to painful pooping, that there is no extrusion of fecal contents, so that there's only going to be more dilation and dilation of the affected bowel segment. So I want you to imagine here, I'm just going to draw a diagram of sort of this makeshift colon as well as fecal matter here. So once we have tightening of our sphincter muscles from withholding behavior, this stool gets kind of pushed back up into the rectum, and this can result in further obstruction even, or further distension of the colon, leading to painful defecation. And sort of alluding to this further, the job of the colon is to extract water from fecal matter so that it's an easier way for us to pass contents, essentially. So if we have impacted stool that is piling up, more water is being drawn out of all this fecal matter, thus making it a lot more dry, a lot more harder to pass, so that we're not able to get that passed into the toilet, essentially. And unfortunately, what can sometimes happen is if there is liquid material surrounding these harder stools, these can sort of pass on their own due to the sort of impacted stool that is present in the colon. So that is called what we say onchopresis. Onchopresis. This is a sign that there is massive constipation or massive backup of stool that needs to be treated pretty much immediately. So now what can we do for these children who are suffering with constipation, especially functional constipation? I'll kind of focus on here because organic causes, they sort of have their own medical treatment, but here we'll go into treatment for functional constipation. One thing that's super important is water intake. As we said before, expulsion of water or extraction of water is the job of the colon. So if we're taking out more and more water from our colon, we need to replenish that, especially if the stool is being backed up. So water intake will help rehydrate the colon, rehydrate the stool so that it's able to be passed in a softer, less painful manner. Additionally, fiber intake is very important to sort of get at the underlying cause of functional constipation. And sometimes we say fiber, eat more fiber, take this fiber supplement. And sometimes I don't even know what that means, but looking up kind of definitions of what fiber is, it's basically a complex carbohydrate that is not able to be digested by our digestive tract. And there are two forms of fiber that I think are important to keep in mind. There are actually two types of fiber, insoluble fiber and soluble fiber. And it's actually the insoluble fiber that really helps with constipation. So there are a couple foods that we can eat that are rich in insoluble fiber. Things like carrots, things like tomatoes, things like couscous, and brown rice are common forms of insoluble fiber that may help with treating constipation. Increasing our activity level also helps make our bowels kind of move and get going. So encouraging kids to be more active, engage in activity is also a very important treatment of constipation. And sort of on the similar preventative side of things, we like to make dietary changes in kids, especially if their dietary habits are not very healthy, essentially. So we want to limit constipating foods like dairy, like excessive carbohydrates, which make up about 95% of a child's diet, but limiting these as much as we can to help prevent any constipation-related symptoms or sequelae. So now that we discussed a couple of preventative things that we like to do for kids and their families, one other thing that can be helpful is actually medical therapy. There are different types of laxative therapies that are very helpful in flushing the bowels out. And these create sort of an osmotic effect in that if there's more solute, more osmoles within the colon wall, water is going to be drawn to those solutes so that we're able to make a softer, more liquidy bowel movement compared to, say, a hard bowel movement that's painful to escape. So there are two different types of laxatives we like to try in kids. One of them are stimulant laxatives, things like X-Lax or Senna, as well as Dulcolax or Bisacodyl. These are stimulant laxatives that usually need to be used on a short-term basis, sort of on the weeks to a couple month basis, rather than prolonged usage of these stimulants because they can develop dependence. On the other hand, we have Miralax as well as lactulose, which otherwise known as polyethylene glycol. These are similar things that we take before colonoscopy. Adults take these before colonoscopies. And these are, again, osmotic laxatives that do not have a dependency, so no dependency issues for these non-stimulant laxatives. And they're really safe to take on a continual basis so that kids have normal bowel movements pretty much, hopefully, every day. Okay, that just about does it for this video here. Hope you found this helpful for sort of the treatment of organic constipation, functional constipation for kids in pediatrics. This is a very common complaint we get, not only in the primary care world, but also in the GI world. It can be helpful to know a couple things about constipation so that you feel more comfortable with a child that's dealing with constipation. So I hope this was helpful, and I appreciate your time.